Okay, hi, here we are again. Just uploaded one, quite a long one. The whole story has been reasonably interesting, but I'm sure it can be summarized quickly. I could probably even do it for you myself. The gist is that we've only just been able to get hold of a copy of the Imperial report. Thought it was a government-only report, and there probably was a government-only report, but it doesn't actually matter because this report is the influential one, the one that is supposed to influence government. The publicly declared one is supposed to be important, and it is. And it's very important information in there. Maybe I've misunderstood it. It's always possible. You know, we're all known for doing it. That's why normally most of these people work in teams where you can run your ideas past somebody else and they can check your work. I would hate to have to work in an environment where nobody checked my work. As far as I know, that's the environment I'm in. So if you comment or you watch this, then maybe you're that person. Now, it comes down to the Imperial College report number 9 on the COVID outbreak. The one that suggested various non-pharmaceutical interventions. If you take the time to read it, you'll find that there is an important table in the appendix, page 20, table 1A. And the odd thing about this one is it's where what they do is they run various simulations through the computer model, and they ask how much do the changes in, say, social policy impact upon things like the number of beds that are taken up in the ICU and how many deaths there would be. And not surprisingly, the number of beds, as we know, occupied can be brought down. It's part of flattening the curve, and you can see all kinds of different figures there, which will show you in actual numbers, relative numbers, the improvement that is made by various measures. And the most extreme measures are the ones that this government, the United Kingdom government, I think, was it the end of March 2020, the ones that they've implemented. And that's basically extreme social distancing to the point of closing all kinds of things down. Industries, businesses. And what I feel I've hit on is that when they do it, they say, what is the effect of doing it at the point when there are 100 ICU beds in a county that have become occupied? But they also do it for 300 beds, 1,000 beds, and 3,000 beds. Makes sense. And normally you would think what that means in the course of a pandemic is you hit 100 beds first. I think this is cumulative, wasn't it? You hit 100 beds first, so do you put the measures in then? Do you wait till it's 300 beds, put them in then? Do you wait till it's 1,000 beds and put them in then? Or do you wait till it's 3,000 beds and put them in then? And you would think that because the curve coming this way as well goes up like that in time, with time going obviously whatever, I find it difficult, time going this way, you would think that the earlier you do it, the more you bring down the curve. So if you do it, I'm completely confused myself now. If you do it early, if the curve goes like this, up and down, okay, then if you bring the measure in here, then you bring the curve down. If you bring it in here, then the curve's already way up here. So how can you bring it down? It's true. But these curves up here, that's confusing the matter because this report says, and it deals with it on a county by county basis. So it says when 100 beds, 100 ICU units, in ICU in intensive care. Okay, so I'm just busy looking up the report now, so I can quote to you. It's the impact of non-pharmaceutical interventions, NPIs, to reduce COVID-19 mortality and healthcare demand by Neil M. Ferguson et al. Cumulative ICU cases. Okay. I'm going to just take my webcam off and film my screen, see if that does it. Okay, so you see this, right? Cumulative trigger to when these measures, these are the measures. This one is the worst. That's just where you close the schools and universities only. And this is the best, where you do everything. Yeah. Now you've got two different R naughts depending on the truth about how dangerous, how easily spread the virus is. It's going to be around this sort of number. So they've given me an example for this, and an example for this. And they've looked at beds and they've looked at deaths. And you can look at either, but obviously deaths is the bottom line. But you can see both. The green situation is really where you want to be aiming for. So the Prime Minister has obviously said, well, we'll go for that one. The full Monty, it's the best. That's what I think he's done. Yeah, that's what I think he's done at the moment. Yep, until I know otherwise. And the problem is that when you do it, when you trigger it, when there are 100 cases, cumulative ICU cases. So 100 cases have come through your local county hospital and gone to the ICU with COVID-19 as the test. And people are saying the test is important. I need to know how many have had it. So when 100 have had it, I come across to here and I say 50 beds will be occupied. I'm going to use the 2.2 value, but you can look up this report. I'm going to look at deaths for 2.2 as well. So again, with 100 cases, 238 people will have died. Once, if you impose the measure at this time point, once 100 cases have come through, you say, right, now we clamp down on it. Then you still get 238 dying. Yeah. Total death. If you wait for 300, you would think it would be better. But it says 236. That's less. If you wait a bit longer, 1,000 cumulative cases, there's 234. That's even less. Each time we've saved 2 lives, but we've done it by waiting. And when we go to 3,000, it's also 234. It makes no difference. So what this report says is, as far as I can tell, if you leave it a bit longer, it gives a chance for herd immunity to have an impact on this figure here. And you get less deaths. But from what it's saying, you wait to 3,000 deaths, not 3,000 deaths, 3,000 ICU cases, you still only get 234 deaths. It doesn't go up. So at no point yet have they shown me on this chart anything better than 234 deaths, which is either 1,000 or 3,000, depending on when you look at it. Now, if the R naught is slightly worse, 2.4, we'll come across here, 1,000, you again see 258, then it goes up like you would expect. But then it comes down. So 258, 259, 257, 258. So I'm needing some help here, because as far as I can tell, we should wait till there are, ideally, the best answer was 1,000 total deaths. No, wrong. My apologies, not 1,000 total deaths at all. 1,000 cumulative ICU cases, yeah, in a county, yeah. And then that county orders those measures. Now, because you get less people dying if you wait before you implement the measures, and they say, but that doesn't make sense. It's not what we'd expect from the other figures on the chart. We want to see some of the other figures on the chart. Yeah, of course. I don't know if this worked. So if you look at this one, it says GB total 510,000 deaths. That's the first of the big curves. And if you look at the dates, it says the model is saying those deaths won't happen till end of May or beginning of June. Yeah. And the y-axis, it says deaths per day per 100,000 population. And this is if we do nothing. Yeah. So what it's saying is around the stage we're at now with Easter, 11th of April, that is about here on the chart. Yeah. And if we do nothing, this will happen. But it's saying if we wait until there are 3,000 ICU cases, we can crush that curve. So we can wait till, say, maybe about here when that happens, and then we can crush that curve. If we do it now, it makes no difference. In fact, it makes it worse because during this month, our children would have been getting herd immunity. And that would mean this peak would have been brought down because herd immunity would bring it down, down, down. We're not quite sure where because we don't have the model that he has at our disposal. So it gave them this information. Neil Ferguson gave them this information, and it seems to be correct. Let's have a look at a little bit more. This one here basically just shows what would happen in America, and each of these curves, they're all drawn on top of each other, so it's pretty useless, but it just says that it would spread across America state by state, and it would be different. Each curve would peak at a different time point in the month, in the year. March, April, May, June, July, August, September, October. This is if you do nothing. Yeah. That's figure 1b and 1a as well. Here now, this is, I think, the one they looked at. This is figure 2. Now this red line here, this is the danger point, because if any of these graphs go over the danger line as the year progresses, March, April, May, June, July, August, September, October, if any of them go over this red line, which you can see they all do, then we won't have enough beds. And that's projected to happen somewhere between April the 20th and May the 20th. So you can probably work out that that's probably about the 7th or something like that. Is that right? 10 and 7, 17. And then the 7th, and then 13 days to there. So I'm terrible at maths, aren't I, sometimes? Maybe the 5th. 5th of May. Around about the 5th of May. Surge critical bed capacity. That's the red line. That's the worrying. We're worrying about going over that, right? Everyone's worrying about it, so we want to bring this curve down. No problem. I can understand that. You've got these important doctors and nurses, especially in intensive care. We don't want them dying. We don't want them getting exhausted. We don't want the patients dying if at all possible. But then the question is this all just about whether they can keep people alive or not, and whether their saintly duties of keeping people alive are fulfilled, or whether in fact instead they have to watch patients die that if only there had been enough of them they could have saved, because that's what we're weighing up against crashing the economy. Lives saved or deaths postponed, you tell me, you know. So okay, all against a backdrop of no parliament running at the moment and a prime minister who we don't know is going to live or die. Yeah. It's worrying times for everyone. But look, what happens if we do nothing? This big peak. If we close schools and universities, it brings it down a bit, but not enough. So you look almost straight away to the best one we've got. Case isolation, home quarantine, social distancing of the over 70s. None of these were enough. So they had to look at more serious measures. And that's what we came to when in that table I showed you in table 1A. This is table 3. And it's kind of the same thing. It's just, it doesn't show absolute numbers of people number of people who lived and died compared to other boxes. It just tells you a percentage difference to which conditions are the best. So if they only looked at percentage difference, they might not have noticed it. All these are 49%. Most of these are 49%, but this one oddly is 50%. And that is because they've rounded these up, because you don't see it when it's two figures, two significant figures on the percentage, but you do see it when it's 238 deaths here versus 234 deaths here. Yeah. I mean, you know, it's costing the economy, it's costing the Chancellor a lot of money. So how he hasn't noticed this, I'm not quite sure. This chart here and this chart here are very much the same. It's just these figures here, this part of the graph here, his plotter didn't do a very good job of it. So he zoomed in to give you a really, really good plot of it here. And what we've opted for, I showed you previously this big chart, if we do this big curve, if we do nothing. And note the blue is how long we're going to be using the whatever measures, whatever policy the government implemented, that's assuming it's in place from about April the 20th, maybe April the 11th, to here. But of course, we all know that the measures came into effect a lot earlier than this chart is showing. But this was just what they projected and the information they showed to the government. And the government seemed to have had the attitude, if we start even earlier, we've got even better chance of bringing this curve down, because the earlier you start, the easier it is to bring it down. And they've also implemented the most extreme measure. The green one, the green one, the green one, the green one here, runs along here and then comes up, compared to the black one, which runs up here. So the green one, school and university closure, case isolation, and general social distancing. That's the lockdown. That's what we're living with. Right. We could have gone with this one here. And this is next peak. So next season, the beginning of the football season, September, October, going back to school, what's going to happen is what you were afraid was going to happen here in April and May, when we perhaps could have coped in the summer. We're now going to be facing in the middle of November and December, when we can't cope. Let's not forget, if this is a year from here to about here, from March to March, when this started, they started working on a vaccine. A year's time, the vaccine might be ready. But if it turns up and it doesn't work, are you going to buy it? Is your government going to buy it? So why buy it now when it's unproven and it won't be available till here? So bear that in mind. The only way out of this, what you're about to see, is a continual lockdown. Let me show you. So they admit there'll be a second peak, and you'll have to do something about it. And this is the current lockdown. So here, and you still get the second peak in November because it ends in September. Okay. Notice the green with the extreme measures is very good because it crushes that peak immediately. Crushes it in April. End of April, this peak will be crushed. Like everyone wants it to be crushed. Oh, victory, victory. And then, then it comes back. And the vaccine still ain't ready. That's what you're buying into, people. I want you to remember that. Now, weekly ICU cases. Remember, British ICU in total in the country is about 5,000, but they're upping it with the Nightingale hospitals, as far as I know. But don't quote me on that. Yeah. March 20th, May 20th, April 20th, about here. So about here, this is where it's projected. Back in March, they projected it would come up like this. And if we brought in the lockdown, and blue is the beginning of lockdown, if we brought it in somewhere here, somewhere about the beginning of April perhaps, yeah, might even tell us. No, they don't tell us. This model doesn't do it on a date basis. It does it on a trigger of 100 ICU cases in a week. That's the on trigger. And the off trigger of 50 cases, 150 ICU cases in a week. So in other words, as soon as I've got too many patients, says the saint in the hospital, yeah, the Prime Minister activates the blue zone. And we live in the blue zone until magically down here, the professor says, it's okay. The nurses union says, it's okay. ICU only has 50 cases. Let people go back to work. People go back to work. And then beginning of September, we get the peak that we have to bring in the measures again because we can see it started rising. At this point, it then takes quite a long time for the peak to come down and for the measures to be relaxed. The measures only be relaxed at 50 cases. And so again, so on again, 100 cases, 50 cases, 100 cases, 50 cases, 100 cases, 50 cases, 100 cases, 50 cases, 100 cases. This will never go away because you're keeping it down, and the whole population, this is only hundreds of cases. There are millions of people in the country. So, and this will go on forever. And yet you can see the blue zone is where nobody's working apart from at home or special workers. The white, this zone here, in the gaps in the comb, if you like, if you view this as some kind of comb, this is where we're off work, and this is where we're on work. This is where we're off work, on work, excuse me, off work, on work, off work, on work, off work, on work, off work, on work. Now that's great. You hardly have to go to work at all. But that obviously crashes the economy, and people who rely on work for money are going to be turning to the Chancellor. Now, I'm not sure the Chancellor can keep going, giving out money until he becomes bankrupt, and the country becomes bankrupt and then taken over by corporations and militia, private militia. So you've got to think about whether that's what you really want. I mean, they might be able to do this for years. They might have enough money in the bank to do this for years. Working from home, saving money on fuel costs, all kinds of stuff might, it might mean that it's not as bad as we think. But I'm a bit worried about it. And considering I think they've missed this in the Treasury, I'm trying to raise it now. The rest of these figures, I'm not going to comment on because I haven't read them, to be quite honest with you. I'm not ready for that. This appendix, haven't read this one either. This is for USA by the looks of it. Right, okay. So let's bring it back. Bring it back. Okay. So, am I wrong? I might be wrong. Like I say, you need to work in teams of people to help you understand things sometimes, because it might read one way to one person, but it wasn't meant to read that way, and they didn't realize perhaps it would read that way, or something. Government policy asked for another model, and the other model didn't take into account this data. This data is still significant. Why? My big question is very simple. Are you ready with a pen? And you work for a newspaper, a national newspaper, or a large broadcasting organization, something like that. Someone to get to ask questions of the people, whether it be Dominic Raab or Priti Patel or Michael Gove or Sir Chris Whitty or Neil Ferguson himself. Not that he's the big shot. No, or Boris Johnson himself, I should probably say. Yeah, because there's two real things going on here. One is, and one of them, well, there's a lot of things going on. But my big question then is did they consider that? Because that seems to be saying two things. One, we shouldn't have a national lockdown strategy at all. We should do it on a county basis so that we count the admissions on the county as to who's gone into ICU. And from that, we wait until there's 1,000 admissions, cumulative admissions from that particular county, whatever it is, and that local politicians or local medical authorities say, right, we've had that 1,000 cases come in, we've been waiting like a week or a month or whatever it is, adding them up, maybe we're 2 or 3 weeks behind London, or the London counties, as it were, and boroughs, yeah. And then we say, right, we've had our 1,000, and now it's the Prime Minister is justified, if he wants to claim the save lives, save our NHS, he's justified in implementing a lockdown now. But in the meantime, we carry on working and we keep the economy going. We keep, if that means London has to go down for a month, then, the rest of the country looks after London and does the work for London that it can, as best it can. And then London comes back online, and the other counties are perhaps suffering. And when they're suffering, London can help out with them, because it's through the worst of it. It's built up its herd immunity. Its ICU is maybe no longer as busy as it was, so it can take cases. But of course, earlier in this scenario, the counties themselves might actually get more ICU cases if they're taking cases from London. But on the whole, that's not really being suggested. The suggestion has been London builds Nightingale Hospital, and that deals with it. So in other words, although the Prime Minister has a problem, because what we've realized is in China, they didn't just lock down parts of China. They basically prevented any travel outside or inside of Wuhan. And what that meant was all the cases were contained within Wuhan. We could have had a similar strategy here, where London was more or less locked down because most of the cases were there. And yet, because London's the capital, politically, economically, it's very difficult, because most of the people that work there, that control it, don't actually live in London anyway. They commute in on the trains and the roads. So it could probably never have been done to London. Now in Italy, it wasn't the same. Rome wasn't the epicenter in Italy, so they were able to lock down some of those villages and provinces and prevent anyone coming in or out. It was then a decision made by the Italian leader to lock down the whole country. Yeah. It may... listen, I'm going to now, talk to you in terms of the Imperial College model. Up until now, I've been doing all my YouTubes without the full benefit of being able to look at that paper. And it's not that many pages, 20 pages. So I've been able to have a pretty good look at it. There's a couple more pages I'm still going to look at. And you never know, I might come back and say I've changed my mind once I've looked at them. I don't know. At the moment, it's hard to see how, because that information is very clear. And it's very clear that whether Ferguson has any political opinion or bias, it doesn't matter. His job is just to put forward the report. If the government misinterpret it and say, because this report says everyone's going to die unless we do this, then they do this. And that seems to be, on the surface of it, what they've done. But it's not true. What they've done is they've invoked a totalitarian regime about a month before it needed to be done. Ruining everybody's Easter. And I think that that question needs to be addressed. And if I'm right, that question needs to be put to the government as soon as possible, which of course now officially won't be until Tuesday. And I obviously have to hide from Priti Patel and her police officers until Tuesday, which is obviously interesting because it's Easter and I've got a nice beard like Jesus. So thankfully I'm still alive. It's Saturday, but maybe somebody got incarcerated on Friday and is living the life of Jesus in the prison at the moment, wondering if they'll come out on Monday. But thankfully you can tell them that someone is still alive who is spreading the gospel. And so there we go. So I've made my, I think I've made my point. That's half an hour. Let's wrap that up nicely. And what do we need to say? Actually, Priti, I'm not going to do that because he's loyal to Priti and he's shitted himself. No way. Seriously. yeah, totally. That's what's happening, dude. That's where it's at. So I got a few seconds to wrap this up. So I'll message out some of my homies in the Bay Area. And what can I say? My friends in Florida and Washington and New York, I wish you all the best with this. I'm sure you guys are probably going to deal with it on a state-by-state basis, which is something that will still be an important issue. According to this study, as far as my interpretation goes, even within the state, you should deal with it on a county-by-county basis. and that way, you know, you manage it. Good luck.